Hi, everybody. Good evening. My name is Jamie Dunn. I am the program director here at Cancer Support Community, California Central Coast, and you're tuning in live inside our office. We're continuing to remain virtual for all of the programming for the time being, but we really appreciate if you're tuning in live. We'd love you to interact with us. If you want to send comments or any private messages, I will be at the laptop and taking those. I will keep you anonymous if you want to ask questions that are personal. For our speaker tonight, I would be more than happy to share those with her and engage in dialogue as if we were here in person, because we would love to be. This is one of our grant-funded talks tonight, so that means that part of what we do for our fundraising to keep all of our services running smoothly and free to all families affected by cancer is that we get these great grant funds, and part of that is that we need your feedback. So at the end of the talk, I would love if you would fill out one of the surveys that's going to be in the link attached as one of the comments. So please take a minute when you're done watching and give us that feedback, and that helps us keep doing what we're doing. And the last thing I'm going to say is that stay tuned for our next presentation of education in November, which is going to be on the topic of what do I tell the kids. It's a program that focuses on age-appropriate language and skill and tools for talking to kids about a diagnosis and about treatment. So whether you're a parent or grandparent or have a loved one with little ones in your life, this is a great opportunity to learn how to navigate those really tough, kind of scary conversations. So stay tuned in November for that, and I think that's all. So I will hand it over to our speaker for tonight, Lindsey Levinson, as one of our staff counselors. She's also a two-time survivor. She'll share a little bit about her background, but we want to welcome her. Thank you.
Thank you, Jamie. I'm happy to be here to talk about our topic tonight, making treatment decisions. So I share your laptop just
Of course.
right at the moment that we're going. So let me get that up and running, and I'll tell you a little bit about myself. My name's Lindsey Levinson, as Jamie said. I'm a licensed marriage and family therapist. I practice here on the Central Coast and also work here at Cancer Support Community, and have also gone through two separate breast cancer diagnoses myself. So anything cancer related kind of touches my heart, and I feel passionately about speaking about ways that we can feel empowered and advocate for ourselves and take care of ourselves through this journey. So that's part of my perspective in coming here today to talk to you about this. And our topic tonight is making treatment decisions, which is a pretty tricky subject. It comes at a time where we might feel overwhelmed or emotional, or there's a lot going on. And so the logistics of trying to make treatment decisions can be harder than we think. So I'm coming to you from the perspective of a therapist. How do you identify what your values and your goals are? How do you communicate most effectively with your medical team? Those are kind of the things that we're going to focus on today. Again, at a time that might feel very chaotic and possibly emotional. So let's review our overview of what we're going to cover today. Introductions, you know who I am. Treatment planning basics, we'll talk about treatment planning, what that looks like. Again, how do you start to evaluate what your goals and your values are so that you can start to treatment plan in a way that fits best for you. Choosing your treatment team, there can be a variety of people on that team, and you have some choice in who is on that team depending on what your goals and values are as well. So we'll cover who are some people that might be on that team. Setting goals, again, when you're reflecting on your own experience, they're very personalized. So while there might be standard of care treatment, your personal goals might be very specific to you. So reflecting on that and setting goals that match your personalized goals. We'll review some of the treatment options. Again, we'll talk about, kind of the different categories of treatment that are available, some common treatments that are used, but I'm not a doctor, so my goal is not to give you medical advice or to really educate you in what those treatment options are, but again, to help you feel empowered in making those choices on your own with your medical team. There's also a little section on caregiving. Caregivers are an integral part of the treatment planning process, and they're going through a lot as well. So we'll talk a little bit about the things that are particular to caregivers. There's questions and answers at the end, but if you have questions along the way, feel free to send them in. As Jamie said, she's watching our account and she'll let me know if there's a question along the way. I'll try to remember to stop and give you the option of asking some questions in the middle of the presentation. But if I don't, feel free to send them in and she'll flag me and we'll do my best to answer them. Okay, so let's get started. Also, again, a reminder to take the feedback survey after the talk. It does help us in getting our funding, helps us to know how helpful these talks are for you. So please complete the survey if you do finish watching the talk today. This talks about who prepared the slides. The workshop was developed by Cancer Support Community. The content was developed independently, and then there were outside medical and psychosocial experts that reviewed it. It's sponsored by Pfizer Oncology and presented here by Cancer Support Community on the Central Coast. This is a disclosure that I don't have any financial relationship to Pfizer Oncology. Okay, let's dive in. Here are some of the objectives today. We're learning how to recognize your treatment needs and how to respond. Being knowledgeable about your diagnosis and treatment options. Again, I won't be the one educating you about your diagnosis or treatment options, but can help empower you to identify maybe some questions that you need to ask. If you want to have a pen and a piece of paper handy, we will cover some questions to bring to your doctor's appointments, questions that you might want to reflect on for yourself, so it might be handy to jot some of those things down as we're going through it. Learning how to build your support system, a very important part of the process, having a support system that helps you through it. Again, it's a very stressful time, so knowing who is in that support system and how they're helpful. Asking questions and advocating for what you need. We talked about information for caregivers and making choices that are right for you. So talking about this being a very specific and independent choices that you're making in collaboration with your medical team. Newly diagnosed tips. This slide makes me chuckle a little bit because it's so pretty and it's so concrete with just a couple of bullet points. It makes it seem so easy, but just I know from personal experience and from having worked with cancer patients for so long that this can be, one of the most challenging times in your diagnosis is when you're first diagnosed and you're trying to process all the information and dealing with the emotional side of it as well. So it's not quite as pretty and bullet pointed as this slide, but I do think if you start to think about what things you want to focus on as you've been newly diagnosed, it can start to help it feel less overwhelming. So let's talk about some of the things that are on here. You or your loved one may have been diagnosed with cancer, but that doesn't mean that cancer defines you, which I think is an appropriate statement. It can start to feel that way in the beginning. Like cancer is everything that you do. It's all your appointments. It's all you can think about. It's all anybody is talking about. But that doesn't have to be the case. Again, if you can have a game plan for how to get through it, it can help to not feel like it's the only thing that you have on your plate. Starting with educating yourself, being aware of what your diagnosis is, what your treatment options are, what is most important to you. Getting support we talked about, which as a therapist, I just think is so important. I don't think it happens often enough, whether that's from our support system naturally, our friends and family, or whether we seek out support elsewhere from a therapist, from the cancer support community support groups, that there are many options to go outside of your normal bubble to get the support that you need, and very important to do so and very normal to need that support at a time when you've been diagnosed with cancer. This also says have hope and courage, which I think again, if you're able to have a clear-cut plan and you feel confident in that plan and that plan is aligned with your values, you're more likely to have hope and courage moving forward. So it's why this background and really thinking about it can help. I always have to add into that that if you're experiencing things that are not hope and courage, that that is also very normal to feel scared, to feel worried, to feel angry, that those are normal emotions to have. And, you know, getting support and working through those emotions, expressing those emotions in healthy ways can help you also get to the point of having hope and courage. So as a therapist, I always have to mention, you know, all our emotions are valid, and there's a variety of emotions that you'll experience through the process that are normal and okay. Treatment planning basics. Some of the things for you to consider as you're going into your appointments with your medical team that you might want to bring to the table. Talks about your age being a factor. You know, you might be looking at approaching your treatment differently if you're 25 than if you're 75. Your values and your priorities might be different. How you're going to respond to the treatment might be different. How you're going to respond to side effects might be different. So thinking about your age and bringing that into the discussions with your medical team. Your point in life, including your family life and work situation. You might think about, you know, am I working full time, and is that realistic, you know, for me to continue to work full time? If I can't work full time, who's going to financially support the family? Are there resources for that? Or your family life, you know, maybe you're the primary caregiver to your kids, or, you know, you were focusing on retiring and traveling, and what's this going to look like? So really reflecting on where you are personally will help drive your discussions with the medical team and the goals that you ultimately develop. For overall health, do you have any other conditions that need to be considered? Your expectations for treatment. So, you know, coming to the table and being honest about, you know, what's this going to look like? I'm expecting to still work full time. Is that going to be possible? Or, you know what, I'm expecting to be on the ground throwing up every day. I've seen movies about people with cancer, and that's all that they do. Is that what this is going to look like for me? Asking those questions so that your expectations for treatment are consistent with what's realistic in terms of the perspective of your medical team. What are your available resources in your support system? There are many supportive services in the community that can help with logistics, transportation needs, things like that. So if there's challenges that you're having, you're limited in certain resources, bringing that conversation to the table. There are social workers and nurse navigators and people that can help answer some of those questions and help you get connected with the resources or the support that you might need. Costs is something that might impact you. Do you have insurance? What is your insurance coverage? Things to consider and bring to the conversation. And any additional questions that you might have that are particular to you. So I could pause just for a minute. I know we've just got going, but if there are any questions that you want to ask, feel free to send those in, and I'll do my best to answer them as best I can. Again, from the perspective of a mental health professional, I won't be able to give you medical advice, but if you have particular questions about how to navigate these things, how to set goals, I'm happy to speak to that.
Mm-hmm. The only piece I'm going to acknowledge is that the slides are a little hard to see on there just because of the color of the background. So I might experiment in the background with the lights to change a little bit. Carry on, Lindsay.
Okay.
Nobody is commenting in the very moment. So.
Okay. Thank you. Thanks for the tech support, Jamie. Okay, I will try and be better about reading what's in the slides. If you guys are not able to see them, then I'll read them as best I can. Okay, the empowerment approach. I think this is such an important place to focus your energy, is in feeling empowered. There are so many things about going through cancer and attending medical appointments that can make us feel disempowered. We're scared. We don't really understand, you know, the medical terminology. You know, there's a power differential when we're in a doctor's office that might make us feel, have difficulty asking the questions that are on our mind, or kind of like deer in headlights. So feeling empowered in your care is such an important piece to pay attention to. And these are some of the things that can help with feeling empowered. The first one is setting your goals, knowing what those goals are, planning a strategy for each goal. How am I gonna meet that goal? This is my goal is to have as few side effects as possible. So what's my strategy? Okay, I've talked with my medical team, A, B, and C. Here's the things that we're going to do to help manage those things. Finding resources to help you, asking for help. Don't do it alone. So important. So many people, myself included, feel like I tend to, in my day-to-day life, manage things myself. I take care of myself, I take care of my family, I can meet my own needs. And when you're going through something like cancer, it's just so taxing on yourself, on your mind, body, and spirit, on your support system. So being okay asking for help is such an important piece. Not trying to do it alone. It was so helpful for me after being down and out for a little while, going through chemo, to start to really be able to identify the areas that I needed help. Did I need help with vacuuming the house because I had just had surgery and I couldn't do that? Did I need somebody to go to the grocery store for me? Did I need somebody to take my kids for a walk? So that I could have a couple of hours of quiet in the house. That when I was able to give people particular recommendations about how to be helpful, it was better, it was more helpful for me, but also I think was empowering for the people in my support system that wanted to help and didn't know what to do. So don't be afraid to ask for help. This is a time where you can use that help, and don't be afraid. You don't have to do it alone. And taking action can make us feel empowered. So if I'm speaking up for myself, if I have a strategy that I can use for each goal, then that can help me feel like I'm taking action, and I'm empowered rather than just on the receiving end of all of this. So it's really, really be helpful. This slide talks about shared decision making, that treatment decision making should be shared, meaning that it takes into account what your healthcare team is recommending, discussing the available treatments that align with your diagnosis, but that also align with your values, your goals, and your current living situation. So when you come to the table with all of those things in mind, then it can help to discuss that with your medical team, and then you feel like it's a collaborative process, which as a byproduct of that makes you feel more empowered. So important. All right, setting your goals. So this gets more specific on how things to consider when you're going to set your goals. So this might be a time, if you're watching, to jot down some of these things to consider, because you'll reflect on these and have your own answers to what these things might be. And you can think about them too as I'm going through them. Where are you in each of these areas? What things come up for you as I'm talking as most important? So it starts with it has two subsections. On the left, your life area. On the right, questions to think about. So starting with your physical, emotional, and sexual health and well-being. So you can reflect on that. What's most important for me to be able to do? Is it most important for me to be able to exercise through my treatment? Is it most important for me to be around as long as possible, and I want the most vigorous treatment possible? Is it most important to me to feel calm and peaceful as much as possible through this? Is it most important for me to be able to still be intimate with my partner? So reflecting on where you are on these things. What's most important for me to be able to do physically, emotionally, sexually, and just with my overall well-being. And as I said, you can reflect on this as I'm going through these and think about what is most important to me. And you can see how this can start to be very individualized. Second subsection here is families and social relationships would be a life area to think about. What's going on in the lives of others that's important to you? Is it important to you to continue to try and care for your grandkids on the weekends? Do you have a milestone, a graduation or a wedding, or some milestone that you really want to be able to attend? What are those relationships like, and what's most important to you about those relationships? Next section is work, school, and home. So we've talked about this. Are you retired? Do you work full-time? Do you work part-time? What type of work do you do? Is it really physically rigorous? Do you want or need to continue working financially? Is that a priority? Are you able to adjust your schedule, your responsibilities, your career goals? Do you have, help at home, local family that can step in and help with some of your day-to-day responsibilities in the home? Or is that something that you're going to need assistance with? Those types of things. Continuing on, again, the life area and the question to think about. The next life area is community involvement. Are you getting the support you need from your community? Are you able to stay active and involved in your community? Is that a priority? You attend church every Sunday, and that's a really important community to you. How am I going to be able to engage with that community and keep that as a priority? Or do you not have community support, and that's something that's lacking for you? So you want to be able to connect with others in the community. Maybe you're going to attend a support group here at Cancer Support Community, and that helps you with that sense of support and community that maybe you don't have in your personal life. So thinking about what type of support do you have in the community, what type of involvement, and what areas do you need support in. Thinking about personal and spiritual growth. Are you taking of yourself? Are you taking care of yourself spiritually? Are you taking care of yourself emotionally? What are you doing to tend to those things, which can really start to go to the bottom of the list when you're starting to make treatment decisions and starting to go through treatment. That emotional and spiritual part can start to seem like a low priority because you're so taxed with other things and your physical well-being and attending so many appointments that are taking up so much of your time. But it's such an integral part of your overall well-being. So thinking about that, where am I at with my personal and spiritual growth? Where am I at emotionally? What do I need, or what do I already have to support me? And if there's anything else that we haven't discussed, maybe you're thinking of other areas, that are important to you as you're delving into making treatment decisions. What is important to me in my life? What do I want to make sure that I'm able to do and make sure that I have support around? This slide talks about understanding your values. So they're very much tied together, your values and your goals. And when you start to have some insight into what those values, what those goals and values are, then it can start to drive the questions that you're asking and the decisions that you make. So here's some examples of things that you might value that you can think about. Values may be, I value being active with my family. Is that important? Maybe that's a value that you have. I value being healthy to attend work, to attend social events, to attend special event that I'm looking forward to. I value having few side effects. I want to get through this with the least amount of side effects as possible. Give me all the drugs that will help manage each one, and I want to do that because what's most important to me is having very few side effects. Or maybe you value having the best treatment available, no matter what. You want it to be aggressive. You don't care if you have to travel out of town. You want the best treatment available, no matter the cost. Maybe that's a value of yours. You can start to see how these things can shift the treatment decisions that you're making. But it's really, almost like pushing the pause button on making those decisions and doing some self-reflection. What matters to me? And I realize that that's a hard thing to do in the midst of the chaos of a new diagnosis, or in the midst of the chaos of trying to make a treatment decision along the way. But pushing that pause button and taking the time to do that can really help you feel more in control and more understanding of what your needs are moving forward. So helpful. Another example was, I value being part of a clinical trial to advance science. Something else that you might think of. But these are just samples. As you're reflecting on yourself, you might come up with your own values. But that gives you something to think about. Helpful tips. Yeah, let's take some helpful tips. The cancer journey has many decision points along the way. I think this is really important to understand, because it's true. I know just from my personal experience, I went through chemo, I went through surgery. I went through radiation, and there were decisions I had to make each point, or I had genetic testing done, and then that brought new information that altered the treatment plan that I was going to do. So there's many points where you're at this point of making treatment decisions, and it's helpful to understand that it's not just a one time. You've made those decisions, and now moving forward, and you're set. There's many points where you might have to do that. And we'll talk about this, but yeah, it's up here as to, not looking too far ahead can be a helpful thing. Knowing that there will be decision points along the way, but not looking too far ahead in the process, not trying to make all the decisions at once. That can be too much. So focusing on smaller pieces. Other helpful tips, thinking about your goals, your life, your current situation. We talked about that. This also talks about working with your doctor to create a written treatment plan. I think anything in writing is great when you're going through this. It is hard to process all this information when you're in the room with your doctor. So having things written down can really help you take a look at it later, make sure that you're understanding what's ahead of you. Okay, this part goes into understanding your diagnosis, which can be a complicated process because, oftentimes it's in complicated medical terminology. Like I mentioned before, it's at a time of high stress and anxiety. So you're not in your, calm body, just listening calmly to what the doctor is saying. You might be very anxious and worried. And so understanding your diagnosis is an important part of the process. And here's some tips to help you understand and advocate for what you need. So first one says, ask your doctor to tell you exactly what kind of cancer you have and to write it down for you. Hard to remember these things. Maybe it's complicated medical lingo that you've never heard before. You try and repeat it back to somebody, the next day, and you're like, oh my gosh, I can't remember. Cytoma, I don't know. Having it written down can help you remember what it was. And if you don't fully understand, don't hesitate to ask. It's okay to ask those questions. The doctors want you to be well informed about your care and your diagnosis. So don't hesitate to ask. I know sometimes you might have that feeling of like, oh, I should be getting this, or maybe I don't want to interrupt, but it's important that you understand your diagnosis. So it's okay to stop and ask questions, to say slow down, to say, okay, hold on, I'm going to write this down. Can you wait just a minute? Asking questions, asking for a copy of any reports so that you have that in hand. You can carry it to different doctor's appointments if you need to. You can reflect and look back on it later. Asking your doctor what they base their treatment recommendations on. Why are they making these decisions? Why are they making these recommendations for you can help understand what's behind those recommendations. Assess talking with your nurses that I think is a really reliable source, especially if you're going to chemotherapy. You spend a lot of time with those nurses, and they're very kind and nurturing and educated. And so if you have questions, about your treatment or about, side effects, being open and honest with nurses as well, they can help answer questions. The last point on here for understanding your diagnosis is talking to other people that have had cancer, especially those with a similar diagnosis. I know for me, that was such a healing and helpful part of my experience, was talking with other women that had breast cancer, that had gone through similar treatments. I felt less isolated. They brought a perspective, that was personal. This is what I struggled with, and this is what helped me. It was so nice to talk to people that had been through it in a way that my natural support system just couldn't understand. It was a really vital part of me understanding what I was going through, what was in store for me. And a little disclaimer that I think is covered later in this presentation is just making sure to remember that your experience is unique as well. I think sometimes when we have that support and we're talking to other people that have had cancer, we compare, oh gosh, they had that side effect, I wonder if I am. Oh man, they had a reoccurrence, I wonder if that's going to happen to me. So a very helpful thing for me has just been to remind myself that my cancer is unique, my circumstances are unique, and somebody else's experience is not necessarily my own. So it's a balancing act that you have to do. I can benefit from the wisdom and the support of other people's experiences that are like my own, but that doesn't mean that their experience is mine. It's still okay for me to have my own experience with this. So if you have a pen and paper, this would be a good time to jot down some questions that you could take to your doctor's appointments. This slide says questions to ask about your cancer diagnosis. So, what type of cancer do I have? You're writing it down as they're telling you. What stage is my cancer? And what does that mean? You know, we might think that we understand what staging means, but you want to hear from your doctor what that means for you. What symptoms of cancer might I experience? What types of tests will I need? Where can I get a second opinion? All really helpful things to bring to that appointment and to ask your doctor about and helping you clarify. And if you have these questions listed, out, and these are important questions to you, you can bring that to your appointment. And your doctor might naturally already go through these things, but you might notice, oh, that wasn't covered, so you can ask the doctor that question. And it helps you really have a full understanding. It causes a lot of anxiety when we leave a medical appointment feeling like we don't understand what's happening or what the treatment is. And so walking away from that appointment with a thorough understanding can be really helpful in coping with the uncertainty of cancer diagnosis and treatment. So I think those questions are really helpful and really empowering. Before we go any further, if there are any questions, feel free to send us a message. Let me know if there's anything that I'm not covering that you feel like would be helpful, and I'll try and answer your questions as they come in. And Jamie will flag me if there are. All right, moving right along. Choosing your healthcare team. Some things that might impact your choice of doctor or the cancer center that you go to might be your cancer type and stage, your personal preference. Maybe you want to be at a major cancer center, City of Hope, that's important to me, or maybe you want to be close to home, and that's what's most valuable to you. Your insurance coverage might dictate which doctors you see or which places you're able to go. And logistics such as transportation, distance, cost, which I feel like are tied into insurance coverage and personal preference. I'm not going to go through all of these, but it talks about possible members of your healthcare team. So people that might be included on your healthcare team, and some are more obvious than others. A medical oncologist, nurses, a surgeon, a surgical oncologist, radiation oncologist, people that might seem like common sense that would be on your team. But there are others as well. Your general practitioner might be on your team. Maybe they were part of you being diagnosed in the first place. You have a really good relationship with them, and so they're following up with you. A social worker could be part of your team, helping you get connected with resources in the community that you might need. There's a whole list over here too, continued. A psychiatrist, a psychologist, a therapist, helping you navigate that emotional side and the stress that you're under. A dietitian, maybe diet is an important part of coping with the side effects, or an important part of remaining healthy and cancer-free. So you might want to include a dietitian on your team. Plastic surgeon, if you're having any kind of reconstruction. There's home health aides that can come into your home if you're needing support in your house with taking care of daily tasks or medical needs inside the home. Hospice care providers. Clergy, if your faith is important to you, that might be somebody that's on your healthcare team. So you can see how you can start to make this individualized depending on what your priorities are and your needs are. And it's good to know that your healthcare team doesn't just have to be your oncologist. There can be many members that reflect your values and what's important to you, and help you feel like you have that balance, which is necessary when you're going through it. The balance, you're not just tending to one side of you. You're not just dealing with the medical aspects. You're also dealing with your diet. You're also dealing with exercise. You're also dealing with your emotional well-being. I'm going to have balance because I'm going to tend to these things that are important to me. And I will acknowledge hard to do because when you're in it, you're just trying to take care of those medical needs. But remembering that it doesn't just have to be, one or two people. You can really have a full team of people available to help you manage all the different facets. Here are some tips on preparing for your doctor's visit. We talked about writing questions down before you go to the doctor, bringing them with you to your appointment. Don't forget that. That would be an important part of the process, and using them to talk to your healthcare team. This is a suggestion that I don't hear as often that I think is really useful, which is writing down the answers to the questions that you're asking, so you can look back on it later and reflect on it, possibly with somebody that was with you in your appointment, or just on your own. But writing down the answers to the questions that you receive. You could also record doctor's appointments, but you'd want to get consent from your doctor to record. Bringing a friend or family member with you to take notes, so you don't have to focus on that. Maybe the loved one can focus on writing everything down and making sure you're asking all those questions, and you can just be present in the appointment. I know that this is a little bit complicated now with COVID-19, but there are some avenues around that. Maybe you can FaceTime and have a family member with you over your phone. Maybe it's a telehealth appointment and you can have them join, or putting the phone on speakerphone, but just maybe coming up with some creative ways to still have that support, still have an extra set of ears. So many people have talked to me about how helpful that is to have an additional person listening in, writing things down. It's a lot to take in the moment, so getting some support about that. Other things, preparing for your doctor visit, you want to tell your doctor or nurse about any medications you're using, including over-the-counter medications, vitamins, supplements. It's important that they know anything that you're taking will be contraindicated with your medical treatment. What you can do, that's, I think, a really helpful place to focus your attention, because there is a sense of losing control when you're going through cancer diagnosis and treatment. Things are happening, so quickly, and they're happening to you, that it can start to feel like you don't have much power, or control over those things. So asking the question of what you can do, what can't I do, is one thing, but what can I do can be helpful to focus on. So some tips about what you can do, what you can focus on. Trying to stay focused on what's happening right now rather than trying to make all the decisions at once. We talked about that. It can be a lot if you're thinking things through all the way till the end of treatment, focusing on right now. Maybe it's, I'm going to decide this type of chemotherapy and when I'm going to schedule that. Or maybe it's just making it to the next. I'm going to just take care of myself for the next few days until I get to that next appointment. Or maybe you've gotten to the point where you're planning for that next thing. Okay, well, I'm going to have radiation, and you start thinking about asking questions for that. So making it into smaller bites can really help. Sitting down with a financial or insurance counselor at your cancer center. I know on the Central Coast we don't really have those built in to our cancer treatment centers, but that still might be something that you could talk to your insurance company about, or if you're at one of the bigger cancer centers, they tend to have people on staff that can help you understand what the costs are and how you're going to pay for it. Understanding the things and how you feel about them will change. This is a really helpful tip as well, because we don't, it is a constantly changing environment, depending on how we feel physically, depending on what's happening medically, and that's okay and it's normal. And I think it's nice to know that, because there are times where you might feel, out of control. I'm really emotional today, I just feel really sad about everything. I'm really scared today. And then the next day you feel empowered and ready to go. And it's okay to have it shifting and changing. And taking advantage of available resources, something that we can do. What resources do I have in my community, and let me access those, not being afraid to take advantage of the resources. They're there for a reason. They're helpful. I can say firsthand, making sure that you have resources that are helpful to you really helped me both emotionally and I think physically manage side effects even better because I felt really supported through the process. We're going to talk a little bit about treatment options. Like I said, some of the things, some of the different types of cancer treatment that are very common, some of the terminology that you're likely to hear. I'm not going to go into a lot of detail about each one of those, but just so you're familiar with the terms. If you have any questions about the specific medical treatments, then you're going to talk to your medical team about those. That's my little disclaimer for treatment options. Before we go into the specific, most common types of cancer treatment, we'll talk about making a decision, things to consider when making a decision. And these are really, some of the things that we've talked about already, the goals of treatment. What is the goal from your doctor's perspective about why we're doing this particular treatment? What are the potential benefits of this treatment? You want to know how is it going to be helpful to you? It's also good to know the type and the severity of the side effects. What are the side effects that I'm going to be dealing with here? What are the doctor's reasons behind the treatment choice and the costs? So, the benefits and the type of severity of side effects, I think are the good things to key into when you're looking at making a decision, things that you can talk with your doctor about. Here's a list of questions to ask about the different treatment options. So again, if you have your pen and paper handy and you want to write down some of these things to bring to your doctor's appointment, this can be helpful. The first question is, what is the goal of this treatment? Like we just talked about on the previous slide. Why are you recommending this treatment? What are the benefits and risks of each treatment? I really want to thoroughly understand the benefit and the risk of it. How can you prepare for and manage the potential side effects that can really make you feel empowered? As scary as it might be to know that there might be some side effects, if you know how to manage them or how to prepare for them, you can at least feel empowered in the process, focusing on that, what can I do? Can't control what side effects I'm going to get, but maybe I can feel like I'm being proactive in how I'm going to manage those side effects if and when they happen. Other questions to ask. How often will treatment be given and where? Is it going to be here at this doctor's office? Do I have to travel somewhere else to do it? How is the treatment given? Is it given via an IV infusion? Are you taking a pill? How is the treatment given? How long does each treatment last? I had some chemo infusions that lasted an hour, and I had some that were 4 to 5 hours. And that was good to know because then I could pack my bag with all the useful things that I would need for that day, snacks and reading material and stuff to watch and my phone and music, and really had to pack a lot of things for those long days. But it helped to know that they were going to be long, and so I could be prepared. Or if they're going to be really quick, I had some radiation treatments that were, once I was set up, it was in and out 10 minutes. And so then I could schedule my work day around that. No problem, I'll do that, in the morning on my way to work. So knowing how long each treatment is going to last can be helpful. I love this question. Does the facility where treatment will be given also offer resources for emotional support? I can't emphasize enough how much the emotional support can be a benefit. So asking that question, and if it's not available, within the treatment center, where can you find it in your community? Is a question that your doctor should be able to answer, or at least refer you in the right direction so you can find that emotional support. It's okay to ask for it, and is very helpful in the process. So another question to ask. You don't get enough emotional support through the process. And from my own experience, I guess that it can be a game changer. Some of the common terms that you might hear when it comes to medical treatment options for cancer. You might hear chemotherapy, radiation therapy, surgery, targeted therapy, immunotherapy. These might be terms that you've heard already, or you might be starting to attend appointments and hear these words thrown around. And not all of us understand what they mean and what they detail without asking or being educated in it. So asking those questions when it's being recommended so that you fully understand it. I'll touch just very briefly on a little bit about each one, but if you have more detailed questions, you want to ask your medical team about each of these types of treatment options. So chemotherapy is a treatment that involves the use of drugs to destroy cancer cells. It's considered a systemic therapy, treating your whole system, and there's different ways that it can be administered: IV, pill, injection. Radiation therapy, there's both external and internal radiation. It's delivered by a machine, aiming high energy rays at a specific body area. Sometimes there's also capsules or liquid placed inside the body that administers radiation, but that may also be another term you're hearing that I've mentioned as well, radiation therapy. Surgery is the most common form of cancer treatment. Sometimes it's used alone, sometimes it's used in combination with other things. And the surgery itself can help with diagnosis, can help with staging, can help with determining what your treatment options are, debulking, trying to shrink the size of the tumor. Surgery can be used for reconstruction if you have to help restore function or appearance of a body part that was affected by cancer treatment. Targeted therapy is a therapy that more precisely attacks cancer cells by targeting specific genes or proteins. It can be administered in different ways, and not all types of cancer can be treated with targeted therapy. Immunotherapy uses the body's natural defenses to identify, attack, and kill cancer cells. It was typically given using an IV. If you have any further questions about any of these things, you can talk to your medical team in more detail. Another supportive service that's good to be aware of is palliative care. Focuses on providing patients with relief from symptoms, pain, and stress of a cancer diagnosis, and it can start at the time of diagnosis. The goal of palliative care is to improve the quality of life for both the patient and any family members or caregivers. It's not the same as hospice care, so it's important to know that that's out there, that that's available, that it's not, one to be afraid of, but can offer you a lot of assistance in a variety of areas. Okay, moving right along to during treatment. We've talked about preparing for treatment, what types of treatment. This is questions to ask during treatment. If you have any questions so far, send them in and let me know if there's anything I can answer for you. Otherwise, I'll just plug ahead.
I'm trying. I said, it's not every day we have a therapist and two-time survivor in the house, so ask your questions.
Yes, yeah, I'm happy to field them. So if you have them, don't be shy. It's even an easier way to ask questions, or you're not necessarily in a group where everybody's going to see you. You can send it via private message, and I'm happy to try and answer the questions.
Yeah. All right, we'll keep going, and I'll interrupt you if we get anybody.
Okay. Moving along, questions to ask during treatment. I know this is a lot of information. I hope that it's useful information, and I'm not just bombarding you here, but I do think there's so many important points in here that can help you advocate for yourself. So we'll continue on. Questions to ask during treatment. The symptoms and side effects that are affecting me the most are. What's important for your doctors to know. I think that we sometimes feel like I should just hunker down and get through it, and I don't want to complain, and I don't even know if this is important enough to talk about, but it is. If you're having side effects or symptoms that are affecting you, you want to bring those up. Oftentimes there's things that they can do to help, and so speaking to those can be really useful. These are interfering in my life in the following ways. I'm nauseous all the time, so I'm not able to eat. Important for your medical team to know. I'm trying to think of another example. I'm so tired, I'm having trouble focusing at work. This fatigue, it's just really intense. So letting them know what it is and in what area it's impacting you. What can we do to manage these symptoms? So empowering yourself, let's find solutions. What's out there that can help me to manage this and let me know what it is. And is there any other complementary therapies, palliative care, supportive therapies that might help with the side effects? And can you refer me to one of those? So really speaking up. They might be things, that your doctor in the moment is aware of and is referring you, or, maybe not. Maybe they need you to speak up and let them know what it is and to request those things directly. Really being open in your communication with your medical team is such an important part of the process, and not being afraid, to ask those questions. It's okay to let them know where you're struggling. It's not easy going through cancer treatments, and so it's very normal to have challenges along the way. Coping with the side effects. You may have side effects from your treatments. Yes, you may. I do like that it says may, because not everybody has side effects. Not everybody has the same side effects, so you don't really want to get too attached to the fact that we're going to have side effects. But, many people do. And so one helpful thing when it comes to side effects is to write down what they are. You might not remember, the following week exactly, how you were feeling the day after chemo. So you might want to jot that down. Write down when it happens, the severity, what you're feeling. You can include how it's impacting your life, so you're armed with that information when you go in for your medical appointments. And again, making sure to talk to your doctor, let them know the things that you're struggling with. Can really help you cope. I've heard many, many times that there are so many things that they can do to help alleviate side effects if we just speak up and let them know. This talks about some of the documents, that you might think about or might have awareness of or might get asked about through the process. So I'll just do a little information about each one. So if you're hearing these terms, maybe they'll sound a little bit more familiar to you. A living will or advance directive is something that lets your doctor know what kind of medical care you want if you cannot speak for yourself. So you might hear that term, especially if you're going in for surgeries, that kind of thing. So I'll ask about, do you have a living will or an advance directive? A durable power of attorney is a person who will make health decisions for you if you're unable to make them for yourself. A financial power of attorney is a person who will make financial decisions for your home and medical care in the event that you're unable to do it for yourself. There's a DNR you might hear of, a do not resuscitate, allow natural death, an AND, or do not attempt resuscitation. DNAR are orders for your doctor if you would not like heroic measures to be taken in the event of cardiac or respiratory arrest. So I'm just covering them so that you hear these terms, you're familiar a little bit with what these things might be. If you want to look into them more, it's something you want to get in place as you're starting treatment or going through your treatment. A will states who's going to receive your money and belongings. Okay, moving on to caregivers, which is a oftentimes neglected subset of the cancer population. They're also, experiencing stress and the worry of making treatment decisions, of watching their loved one go through the treatment. And so I think it's important to mention their experience as well. Some tips for caregivers specifically. So starts off by saying, while you might feel rushed to make decisions, it's okay to slow things down and think through them. I think from a caregiver's perspective, in particular, you're worried about your loved one. Let's just get to this. Let's get through the treatments. Like, let's go. I want them to be okay. But that rushing can make you feel maybe like you don't understand what's happening or what the treatments are, what the side effects are going to be. So really giving yourself permission to slow down, to thoroughly understand the treatment options that are available, and to make a decision in collaboration with your loved one. It's okay to slow down. And can help give you a greater sense of control and help you to be a calm presence for your loved one when you're in those appointments or making those decisions with them. Taking time to ask questions, think through the steps, same kind of concept, just being thoughtful about it, working with your loved one, communicating with your loved one. You're an integral part of that process too, so you have a voice, and it's okay to slow things down and take time to really do it. taking notes for not only for your loved one, but this can also be beneficial for you. So if you're the note taker in the session, it can help you to thoroughly understand the information, help you to keep track of are there any questions that haven't been asked that you want to ask. Helpful for you as well. And then another advantage to that is comparing your notes after the appointment. So maybe you want to powwow with your loved one and talk about, okay, here's what I heard. What did you hear? What's most important to you? This is my concern with this particular thing, but it allows you, if you interpret things differently, or maybe you heard something that they missed, or vice versa, you can have a discussion about it. So having some notes and reviewing them after the appointments when you're ready can be helpful. No rush, because there's the emotional side of it too. Taking time, maybe after the appointment, you go for an ice cream or something, to just kind of de-stress. But then maybe once you get home, you review the notes together so that you both feel like you're understanding what's in store. This is a tricky one, I know, for caregivers. Make time to care for yourself and ask for help when you need it. All of your energy and all of your attention often goes to your loved one. And same with the support system. The support system often goes to your loved one as well. And so it can be really, really difficult to take time for yourself and to ask for help. But it's so helpful in you being able to be present for your loved one. So it's okay to take that time. It's okay to take time away. It's okay to ask for help that you might need. Maybe having somebody in and spend 2 hours with your loved one when you get to go take a walk. Those things can be really beneficial and put you in a position to be that calm and supportive presence. So it's okay. You have permission to need help and support along the way. So the next steps, that's a lot of information, I know. I think, like I said, if you were able to take notes, to make it into more simplified steps, that's helpful. And then this talks about, what are the next steps once you have your goals, your values, you've identified those things, what are some other things that might be helpful moving forward. So the last few things, being selective as to where you find your information, so important. I know in the moment, you want to go to Google and search the symptom that you're having or search your diagnosis, but that can really lead to a lot of anxiety provoking and inaccurate information. So really looking to your doctors, your medical team, reliable resources to get information about your type of cancer and the type of cancer treatment is really important. This I mentioned earlier, benefiting from the experiences of others, but remember that your path is unique. So you want to listen to others. That can be so helpful, but not thinking that their experience is yours. They might have done a different treatment. They might choose to do a different type of treatment. They might have particular side effects. Those things are unique to them, but your path is also unique, so it doesn't have to mirror somebody else's. And finally, choosing a doctor that you can trust and feel comfortable openly communicating with. This can also be very individualized. One person's favorite doctor might be another person's, where they don't feel connected or they don't feel heard by that doctor. As long as you feel connected and you feel like you trust that doctor and can communicate about what your needs are and get your questions answered, then that helps you feel more confident in your care. So really tuning into does this relationship work for me, and I'm getting my needs met here. And I think that's it. So I hope that was helpful in identifying some things that might help. I know that it's such a stressful time, and you can feel like your world is turned upside down. But the more you're planning, the more you're taking care of yourself, the more you understand what's going to help you to feel empowered. I think the better, even though it continues to be challenging, it can help along the way. So I appreciate you tuning in to hear what I had to say. If there are any remaining questions, please send them now before we close up for the night.
I'm going to include the link for the survey. Please take it. I'm going to bring us home with a couple of things about what we do and about some additional resources. But don't be afraid to get your questions in the last minute. Lindsey's still here. And yeah.
Okay, thanks. I'm going to have Jamie. Jamie's going to come up and go over a few things herself. Thank you for having me. Everybody take care.
All right, that was a lot of great information, and we're so lucky to have Lindsey here to tune in and share her experience and her expertise. Um, and again, I apologize that the slides were difficult to view live. This is one of those programs that was created by our national nonprofit headquarters, so they create these slides and send them to us. So I will make sure that the slides are available to you, and if you really want them sooner, go ahead and email us at programs@cscslow.org, and I will get them to you directly. So thank you for your patience with that. This is a little bit about what we do here locally. So our main office is in Templeton. We do have some groups in St. Louis. Everything right now is currently virtual through secure Zoom or phone, but we are going to slowly start to open up to more in-person programming starting in November. If you want more information, you're welcome to visit our website, which is right up here, www.cscslow.org. And if you want to get signed up, all you have to do is email or call us. All of our information is there on our website. Some of the things that we provide, everything is absolutely free to patients, loved ones, kids, the whole spectrum, anybody affected by cancer. So that can be from free short-term counseling, that can be lots of different types of support groups. There's something for everybody. Mind-body activities, social programs, lots of different things, hats, wigs, resources, anything you can think of related to cancer. Give us a call or an email. We probably have something to share with you. These are a couple of resources that are coming again from our national headquarters, so our affiliate that is based in Washington, D.C. One of the things that they have put out is a support line. So it's not a crisis line, but it's something that's staffed by trained cancer counselors. So if you have questions, concerns, you just want somebody to talk to, if it's outside of our hours or something that you want additional support with, give them a call. They actually have weekend hours now as well. So the number is up there, 888-793-9355. That's on our website as well. Real quick, the Experience Registry. If you ever wanted to contribute your story and have that go straight to research, that's one of the beautiful ways that you feel like you can give back to others and can benefit from your experience, because sharing that can contribute to real research and real data about why social and emotional programs like what we offer matter and how they impact. So if you want to share your story, that's a great place to do it. Open to Options is the perfect program actually with this talk, because Open to Options is something that I'm trained in. I'm a licensed marriage and family therapist myself. So Open to Options is a tool that can help you to think about your values, your goals, all the things that Lindsey mentioned about treatment, and really refine a very concise list of questions. You can take to your doctor's office and feel really confident that you're going to go in prepared, that you're going to feel like you have the whole scope of your life and your treatment options available to you. So if you want to access that tool, give us a call. I'd be happy to set up an appointment and help you to figure out how to get these questions answered for your treatment. Lastly, frankly speaking, that is what this program is called. It's a series of educational programs. I talked about the registry, so I'm just going to click on through. This talks about just part of the grassroots efforts that has to do with Cancer Support Community Headquarters and how they are working hard on our behalf to advocate for people in Washington, D.C. and other major cities to work on how things are affected by law and how the key issues are really important to how we keep these things going and how our voices are heard and evolve in cancer care. So it could be a lot better, certainly. So there are a lot of people that work on our behalf. My Lifeline is a great tool. If you've ever heard of Caring Bridge, that's a similar type program. So this is one that's cancer specific. It's a great online tool that can be your portal to helping family and friends stay tuned with what's happening with you, instead of going in for treatment and having to field calls and texts and all these people who love you and want updates from you. This can be your source for sharing all that information. How are you doing? What do you need? Do you need transportation? Do you need groceries? This is the kind of the one-stop place to be able to really help everyone stay involved with your care and be on the same page. Ta-da! You did it, guys. Thank you so much for tuning in. Again, please, if you have a moment, take the survey. It's in the comments of the Facebook post. And if you need that for any reason and didn't get it there, please email us, and we really appreciate your feedback. So we hope to see you in a future event and right here back in our office when we can open up. So thank you so much. Have a great night.